HIV intersects at a space that touches on several sensitive and deeply personal and cultural issues. It forces us to talk about sex, homosexuality, our faith traditions, justice, and our very humanity. So while the science marches on to provide better testing and treatment options for HIV, it will mean very little if we refuse to improve our social responses to HIV. According to Dr. Lisa Fitzpatrick,
HIV is as prevalent as it is in actually worldwide when you think about it. Across the Black diaspora, it seems that the health disparity in HIV/AIDS is consistently in Black communities. And I think this is a very complicated question, but I think it has to do with sexual networks and partner choices. I think Black populations are more likely to engage in sexual behaviors with people from their own background. So Blacks tend to engage in sexual relationships with Blacks. I also think that across the Black diaspora, Blacks have the highest rates of poverty, homelessness, substance abuse, and maybe even mental illness. And I think all of these social issues compound and complicate risk factors for HIV.
She sees a significant part of the solution moving forward is having HIV screening as a part of normal health screening protocols.
HIV screening should be integrated with routine health care. And the reason for this is because HIV testing remains a stigmatized issue. So people are not presenting for screening because they don't want to know they're infected. If they find out they're infected, a lot of people don't feel comfortable talking about their diagnosis or disclosing. So if healthcare providers around the world would automatically test for HIV and treat this as the treatable disease it is, similar to diabetes or heart disease, we test people for these conditions all the time, but we don't integrate HIV screening. And I think that's one of the single biggest things we can do to eliminate the stigma from HIV is to routinely test for HIV.
She goes on to make the point that while there have been major gains,
we have made a lot of achievements and successes in addressing the HIV epidemic, but we still have a lot of work to do in some of the most basic areas of this epidemic. For instance, we are having a difficult time ensuring that people who need information, basic information about HIV, know about HIV, knowing where they can get a test, knowing where they can get treatment, knowing how the virus is transmitted. We are also having a very difficult time shedding some of the stigma associated with HIV. So people are ashamed to be tested and ashamed to be associated with this virus. And I think before we can really end the epidemic, we have to address those two things, education and stigma.
For those who believe that HIV must remain a scary and stigmatized condition, Dr. Fitzpatrick had this to say.
If the fear goes away, then maybe people will be encouraged about testing and seeking care. If they get on medication, their virus is controlled, they're much less likely to spread the virus. We know that people who have their virus controlled are 96% less likely to spread the virus to someone else. So it would be okay if the fear goes away. I think fear is appropriate for a certain population, maybe young people. But I think overall, fear is also part of the problem. I think the fear helps perpetuate the stigma associated with HIV.
The future of HIV and the race to zero is not something that the Global Fund or the US can achieve. The only one that can is you. Dr. Fitzpatrick's prescriptions are
the traditional prevention strategies that we've had. People need to know their status and their partner's status. Abstinence is still a mechanism for prevention. Condom usage, but condom usage has to be consistent. So I think treatment as prevention is appropriate, but it has to be in conjunction with other forms of prevention, the traditional approaches that we know about. And also the education is a form of prevention, because if people have the information they need, they're more likely to get tested and follow up with providers, take their medication so that they can be healthy.
So, will you always use a condom? Will you support and pressure the government to ensure that no child is born with HIV? Because irrespective of what you feel or believe, we are all either infected or affected by HIV. So, live up, love, protect, respect. I am Devon Hunter, reporting for CBMP and CVM.